Dr. Irma Fleming. She's a surgeon at the Burn Center. And then we also have Tricia Davis-Winter, who's the director of the Utah Office of Homeless Services. So we'll start with Dr. Lewis.
Hello everyone. Do I need to put on microphones or are we good with microphones? Okay. So, would you like me to just start with an introduction and go from there? Okay, hi, I'm Giovanni Lewis. I am the current medical director for the Burn Center here at the University of Utah. I've been here for over 14 years now, and I've been the director of the Burn Center for over 5 years. And so my goal here today is really just to bring awareness to frostbite. I feel like a lot of people forget about frostbite during the winter. We go off skiing and enjoy our times, and then we have some small injuries that we don't know how to manage or to take care of. Frostbite really is just exposure to cold injury. And the more we're exposed to being outside like we are today, we tend to have more tissue that could potentially freeze if we're not prepared for it. So those people who are at risk are those who are out doing ski activities or activities in the snow. Those who are without housing are particularly at higher risk for developing frostbite or cold injury. And then we have those who are young or really old who don't know how to really navigate keeping themselves warm outside, or their skin is just more fragile. And so what we tend to recommend is for everyone to bundle up as much as possible. The cold injury itself can be a first degree, which we call frost nip. Everyone's had frost nip. That's where your hands become really cold and numb and tingly and a little red. We call that first degree frostbite. We have second degree frostbite, and that's where it gets more than just cold. You become numb and have pain, and your hands can feel chapped, and you can develop a lot of blisters, but they're usually clear. Then we have third degree frostbite. That's where all of the tissue that's been exposed to cold actually freezes, and there's no longer any blood flow to that tissue, and so it starts to die. And in those cases, that's where we want to help prevent having third degree frostbite so that we don't have to lose hands and our feet, our nose, our ears. Those are at the highest risk for frostbite. So that's a pretty good overview. Do you guys have any specific questions you want to ask me about frostbite?
I have a question for you.
Yes, hi.
For children,
Yes.
are there different symptoms, different things, different ways they're affected, or that parents should look out for?
Sure. So for kids, the number one issue is that kids don't usually tell you. And so you have to be vigilant. So we recommend for children who are out having ski activities that you, one, bring them in every 30 minutes and be aware of how cold it is outside. If we're below freezing, just know the amount of time that you can spend outside is going to be less. And so you should periodically have your little ones come inside, check over, make sure they're warm, make sure they're wearing all of their appropriate gear. We do recommend mittens. That keeps the hands a lot more warmer than regular gloves. And then we also recommend that you have waterproof shoes, socks that don't have any that are water wicking and allow your toes to stay warm. And then of course your usual outdoor gear. Thank you. Other questions, or should we have Dr. Fleming come and chat a little bit more about how we care for and what to do once you have a frostbite? That'd be great. Okay, great. Thank you guys.
Okay, can you hear me? Okay. My name is Irma Fleming. I am one of the burn surgeons, but I'm also the Associate Medical Director for the Burn Center. I am from Chicago, and I've been in Utah for 6 years, so I know a bit about frostbite also. And in addition to what Dr. Lewis mentioned, some of the tips and tricks for preventing frostbite, in addition to warming up, is the mittens, but also hats and scarves as well as headbands to cover up areas like your ears, face mask for your nose, as well as moisture wicking um, socks, as well as jackets, windbreakers just to protect you from the wind. Wet, in addition to cold, makes you more prone for frostbite. So those are some of the things. When do you seek medical attention? So lucky for us, we support 5 states. And so even if you're not here in the Salt Lake City area, your local physicians can frostbite is hypothermia. So if you're noticing that your loved one, especially children, someone mentioned children, if they're having shivering, confusion, slurred speech, if they're lethargic, like very lazy, can't really tell you anything, they're not moving much, that's a concern for some hypothermia. Also, if they're having numbness and tingling, itchiness in the areas, redness, swelling, those are times to reach out to your primary care doctor or your local doctor. And then we can always transfer you here if we feel like there's something that needs to be done more urgently, or we can make recommendations to your local hospital. Okay. Questions about those things?
How cold does it have to be for frostbite to...
Yes. So even though we do publish freezing or extreme temperatures, but sometimes it doesn't necessarily have to be freezing. It doesn't have to be 32 degrees if you're wet and you're cold. The moisture actually cools you off even more. So if you're sweating in your socks and your feet are wet and you're outside doing snow activities and it still may be like 35 degrees outside, you may still have some frostbite symptoms. So,
Thank you.
any other questions? Okay, good. All right, I will move on. Okay. Thank you.
Hi, my name is Trisha Davis Winter. I'm the director of the Office of Homeless Services for the state of Utah. I'm here to talk a little bit about the Code Blue legislation that was passed in 2023. Throughout many years that I've been doing this in homeless services, we've seen the impact that frostbite and other health conditions are happening through the cold weather. Stakeholders, our state homelessness coordinator Wayne Niederhauser and Representative Steve Elison really saw the need to pass some legislation to address this issue. This initiative activates during severe weather conditions, particularly when the temperature drops to 18 degrees or below with wind chill. And severe weather conditions can also be determined. The primary goal is to ensure that shelter and safety for individuals experiencing homelessness is taking place during extreme weather events. Code Blue is called today, for example, in certain areas across the state. Davis, Weber, Washington, Utah, and Salt Lake counties are required to comply with the Code Blue requirements that are in our state law. Winter overflow operations take place from October 15th to April 30th every year, with our first Code Blue call this season occurring October 18th. To date, we've experienced 66 Code Blue nights this winter throughout the state. 70% of the 95 days that have been in our winter response period have been Code Blue in one county or another throughout the state. We've got record capacity for emergency shelter, particularly in Salt Lake County, with 982 total beds available. This includes 732 overflow beds throughout the state. Our homeless resource centers throughout the state and emergency shelters can flex capacity up to 35% to take people in who are in need. There are specifically 250 Code Blue beds that are activated during the Code Blue alerts. The Code Blue operations are really a collaborative effort that involves the local governments, nonprofits, and grassroots organizations. These partnerships ensure comprehensive shelter access and services for those in need, emphasizing community support. Volunteers play a very critical role in the operations of these Code Blue sites. These Code Blue sites would not be able to operate without volunteer participation. To contribute to the state's efforts and volunteer for Code Blue, We highly recommend it. It's a very important and interesting experience. You can go to endutahhomelessness.org and click on Code Blue to find out what sites are operating and get involved in that. We're also coming up on what we call the point in time count. It's an effort across the state to go out and interview individuals experiencing unsheltered homelessness. This count helps us really plan for what the needs are around winter response in Code Blue, and is a voluntary. Stop and take any questions.
I have one for you.
Yeah.
What are the efforts to let folks who are unsheltered know that there's a code blue coming?
Yeah, that's a good question. Part of the legislation required the Department of Health and Human Services and our office to have a plan to get that word out there. The End Utah Homelessness website, if you go to that now and there's a Code Blue, an alert will pop up and it says get help. So we try to get the word out there to individuals experiencing homelessness to access that website. The other way that we're really promoting that is through the emergency shelter systems and our nonprofit and street outreach workers. Any other questions? Okay.
We're going to come back just to talk about our partnership with the state here, in case you have any questions. So I do want to introduce one other person. Courtney is our outreach burn nurse. She's been doing this for a number of years. She partnered with Annette Newman, who has retired recently but still works on the task force with the state, and has allowed us to create a partnership and with the burn center in the state to be able to support care for patients who experience frostbite injury or cold injury. One of the important things to note is before we had the Code Blue, we were seeing about 30 admissions to our burn unit related to cold injury. After that, we've seen at least a half in the number of admissions to our hospital for frostbite injuries. So to me, this is directly correlated to the legislation and the work that's being done at the state level. And so for us, that's always great, because then we don't have patients who have significant cold injury, which is very deforming and can be, it can lead to lots of more needs on the healthcare system, especially if people lose their legs or feet. They're no longer mobile, so that's a big deal.
Yeah, some of the other great partnerships that we have, of course the Code Blue being able to kind of help and provide that data of how many frostbite patients we had to kind of help that legislation go through. We also provide education and resources to these street task forces, really these boots on the ground who are seeing these people and being able to recognize frostbite and maybe give them a warm pair of gloves or a warm pair of socks. We also do an annual donation with our burn center under our Christmas tree, where we bring in donations of warm hats, gloves, socks, and they go directly to the point in time count. And so while they go out and interview our homeless population, then our people who are experiencing homelessness, they will be able to give these warm items to those people right to the streets. So I think that's kind of some of the great outreach that we're able to do as well.
Yes. So in general, cold injury is a community issue and a community health problem. So partnering with the state is important for us to be successful in prevention. Any other questions you guys have for us? Do you need spellings of names or anything like that? Perfect. Okay, great.
Your name again?
Yeah, Courtney, Courtney, Lawrence, Lawrence.
And you're in the burn unit?
Yes. Yeah.
Thank you.
Great.
Very good.
Thank you, everyone.